I spent the better part of last year with a journalist writing a book that just came out called "Blockchain for Medical Research: Accelerating Trust in Healthcare,"
Hmm.
and it was written before any of this started happening. It was more about, my mother died of cancer, accelerating cancer research. It takes 17 years to go from bench to bedside to really get an idea through the system of science into practical application in hospitals. And there are so many opportunities to accelerate that. And now, of course, we're in a situation where, we want to have that vaccine tomorrow. But which of the possible vaccines is it? How much does it cost to run those trials? How many patients are there? Are they willing to consent to be part of that trial? How long does it take to get a trial through with the right amount of people in it? How do you take that information and put it out to the world so that all of these things can be merged together and meta-analysis can be done? And how do you arrive at what Heather was talking about, enough of a level of evidence that people can make it actionable and can go ahead and say, yes, we're going to give everyone in the population this injection into their arm, and we don't, know all of the side effects to it. You can't do that just with a good idea. There's not enough people, around with the disease who are willing to be part of a trial and then do follow-ups to see the outcomes. So I think looking at the process of research and figuring out where the data can be shared better, where open science and Web3 can be a major component of that, can get that data into more hands of people who can do analysis, how you can track the provenance of that data, how you can track the provenance of what was done with that data. I mean, you want to know that the analysis that was done on it wasn't just somebody running analysis until they found something interesting and then publishing a paper. You want to be able to track back how that was done. Is it statistically significant? Is it statistically valid? And then that information being merged with other things coming out. Not all data can be merged together, some can. So can you track meta-analysis or metadata aspects of data so that data can be shared? Can you track the provenance of who contributed? I mean, one of the challenges in science is, everyone's pitching in now, but when you get to a problem that lasts for years and you're trying to solve it, well, as a researcher, if I'm at a university, I get grants, I get tenure, I keep my job based on the papers that I publish. And so I keep my data tight until I can produce it. But if we want everybody trying to solve the problem, how do we get that data out there? How do we track that intellectual property so people can get credit for being the one who came up with the idea, for being the one who collected the data? On the patient side, how can those people be rewarded for saying, yeah, I'll volunteer to be in this study, even though there might be danger to it? Can we put an incentivization in there? Can you incentivize people to contribute their health data, or contribute their contribution to a study, in a way that gets them something back? And so that incentivization can be factored in, letting patients control their own data, and maybe even, clicking a button when they see a study that they want to be part of. That might be a little bit too future state for what we can build and implement today. But I think looking at the process of research from the researcher's side, from the scientist side, from the doctor's side who needs to put it into practice, but also from the patient side and the subject side, those are ways we can start to look
Hmm.
at speeding up that hopefully not 17 years from bench to bedside, hopefully 17 months or 17 weeks. I don't think 17 days is possible, but if you get the right data in the right hands and the right level of analysis to it, you can speed these things up considerably. So that's where I would definitely want people looking for opportunities.